Hi, my name is Cyrus Wirls of the Institute for Spirituality and Health and the Greater Houston Healing Collaborative. And I'm here with one of our most experienced community mind body medicine facilitators, Sister Mama Sonia, to talk with her about the connection between COVID, health disparities, and mental and physical health. So, Sister Mama, thanks for being with us.
Well, thank you, Cyrus. It's an honor to be here in this terrible heat in Houston, Texas in July 2003. Oh, June 2003. It's good to be inside.
Well, grateful for all the work that you've done and for you being with us
Mhm.
through the heat. So, the first question I have for you, Sister Mama, is what impact have you seen COVID have on your community?
Oh, wow. I was just talking about it today with someone, particularly COVID and children in the community. We had children who were out of school for up to 2 years. We have children, let's start with the younger children. When they were about to start school, they couldn't go. So they had no social interaction for 2 years. So when they get back to school and start school, you want them to walk in a line and do this. They don't know anything about that. So they were really like kindergartners coming in, although they may have been the second or third grade. Um, the isolation that so many people had, and there's
Oh no,
on.
Sister Mama,
Yes,
you froze for a sec.
you did too.
Oh,
Yeah,
well,
well,
right when you could back up to right when you said the isolation that people had.
okay, yeah, the isolation that people had. We had people. I had a very, very dear friend who lives by herself, and she was working from home. She didn't go to church because she couldn't go. Her family doesn't live in Houston, so she felt totally isolated. Now we would take her food from time to time. She was there on her porch. I'd be in my car. We talked, but she said the total, and she's a widow. The total isolation is something you can never, ever forget. I look at all of the businesses that closed in our community. You pass by. I remember I was in a galleria, and I'm not. Yeah, I was in the gallery across the street, and I saw all those business closed. And I said, "Strange." I had tears out of my eyes, not because of that, because if it happened to the people in the galleria, think what happened in my community. We lost so much. The ability, again, the social interaction, the ability just to talk. I'm not saying we lost it, but that was something we couldn't do at that time. I know we're going to talk about the health implications later, but that was another thing. The health, uh, it impacted our health, how we take care of ourselves, and all of the deaths, the bereavement in our community was, it's not over. I was talking to somebody today about how I lost my husband's nephew was my nephew, and then my cousin's cousin, who was my cousin. No blood, but in the black community, if you in a family, you cousin. But those two young people, one went into the hospital COVID free. She had had a kidney transplant years ago, and she went in. And when she went in, huh, it was she got COVID and died. My nephew had COVID. He was living with his parents. He was a truck driver, so it didn't make any sense for him to have his own apartment. He just stayed there because he was on the road all the time. And when he got COVID, he moved out to the hotel. They didn't hear from him in 2 days, and of course they were calling every day. He had died alone in the hospital. I mean, in the hotel. He was morbidly obese, but still. So I look at the death now that's of our community, and that's something you just never ever ever get over.
Hmm. Well, you've touched on health. You've also touched on grief and bereavement, which probably ties into the next question, which is what impact has COVID had on mental health?
Well, mental health is health. Mental health affects everything. So when we say mental health, we're talking about our living and breathing and just existing. Um, what is it? When we talk about mental health, you say, oh, yeah, my cousin, she crazy. Oh, Uncle Buddy, he crazy. No, no, no. When we say mental health, we're talking about everything, our mind, our soul, our body, our feelings. Again, I talked about the depression. A lot of folks were isolated, and depression was uh, a number one issue that people were going through because they were isolated, because they were by themselves. Depression was able to take over. Those of us, I have a chronic disease, diabetes. Depression is a byproduct, a side effect, clinical depression of that type 2 diabetes. Any any of the chronic diseases you may have, depression is there. So it was enhanced by the isolation, being by yourself where you couldn't talk to anybody or touch. I'm a person that loves to touch and hug and couldn't do any of that. And our mental health, uh, uh, our children, we will never know, ever know what it's like to go from being in a classroom, seeing your friends every day, to just being in a room on a computer. I know of a young man who he was already kind of a loner. He moved to another city. When he moved to that other city, he was just starting to meet people. And guess what happened? COVID. So again, when he graduated, he really had no friends because he didn't get a chance to interact with anybody in his high school. We think about the younger children. Again, I'm a big proponent of people being together and just talking and laughing and dancing and acting and just having a good time. Our young children didn't have that opportunity. So they're stunted. Their growth is stunted when it comes to social interaction, when it goes to their mental health, how they think about themselves, how they think about people. Then let's talk about the adults. Yeah, depression was big because when we watch the news every day, and it's not like we want it to happen, but we were waiting to see, are we going to hit that million mark? And when we hit that million mark of 1 million people dying, of course that affected us mentally. Every time we turned on the TV, at the bottom of the thing, they had the what is it? I can't think of the name. That they had, how many people died, how many people were infected, and all of that. And you turned off the TV, but then you still wanted to know what was going on. My friend she said, "Girl, I'm so glad I didn't go to the funeral last week." I said, "Why?" She said, "Because we had a COVID outbreak at the funeral. We had I think 7 or 8 people came down with COVID. Thank God everybody was had been vaccinated and all." I just talked to another real good friend. She's at home with COVID. She's sick, but I think with the heat and everything else, it's probably exacerbating. That's not a medical thing. That's just what I'm saying. So when we talk about COVID and our mental health affects all of our being. So when we talk about even the name COVID, everything we say now, girl, when did that happen? Oh yeah, that was pre-COVID. That happened in the middle of COVID. Okay, that happened. Well, COVID's not over. A personal testimony. I was having a really, really bad pain at the bottom of my feet. I was working at the time, and I was a contact tracer, and my foot was hurting so bad. I mean, really bad. And so the funny part is I'm trying to go to the doctor, and here is my phone, right? It was what do you call it? A virtual. So I'm trying to put my phone under my foot to show him. We just both fell out laughing. This was on a Tuesday in the middle of August. Well, about June 21st. He said, "I want you to get the first appointment you can get and come on in." That was on a Tuesday. I couldn't get another appointment until August 1st. By that Friday, my foot it was hurting so bad. I decided to I can't do this. I went to the doctor, Got to the hospital. We talk about effect on the mental health. Got to the hospital. The nurse said, "Who's the patient?" My husband said, "She is." He said, "Kiss her goodbye because you're not going to see her for a while." So I had to go in the hospital by myself. They were talking about amputation at the time, but they kept me on antibiotics. It was going to my bone. And, you don't want it to get into the next toe and it keeps moving over. So I had one procedure to look at it. They came out, this is, we're going to try some more, try something else. That didn't work. So I ended up having my toe cut off. Now, prior to that, they would play this song over and I was at Bentop at the time, but I didn't have insurance. And I must say, when they found out who my surgeon was, they said, "How did you get him? He's the top one in the city." But when I went in, and I was just, one day I was just crying, just really crying. And they said, the nurse said, "Why are you crying?" I said, "Because I don't know. I'm just hurt." She said, "You get phone calls all the time. I don't know why you upset because you talking all the time." And she said, I said, "I'm crying for the people who are alone, who have nobody." And it just touched my heart. I couldn't imagine being at the hospital alone. Tears welled up in the nurse's eyes. She said, "I'm the one who brings the, what do you call it? The tablet, so the people can say goodbye to their loved ones." I mean, it was crazy. So you talk about mental health. It really affected me mentally. When I came out of surgery, no one was at a hole. When I looked up and I had, what do you call it, the twilight, I could see them, but I couldn't feel them and couldn't hear them. I wouldn't really, I really didn't know what's happening. I eventually went to sleep. And when I had to find out that my toe was cut off, I was an amputee, just a toe. Thank God. Your little toe doesn't really do anything. It's just there to make your foot look cute. Doesn't do anything as far as the balance. What do you think that did to my mental health? I felt so alone. I felt depression hit like nothing because nobody could hold my hand. Nobody could touch me and say, "It's going to be all right." So I think that was something minor. Although, one of my friends is a doctor. She says, never say, there's no such thing as a minor surgery. Never say that. But it was minor compared to, what other stuff is going on with people. And when that bit of depression started coming, I can only imagine. I really can't imagine, I guess, what other people were going through. The depression from losing people, from losing, having severe illnesses, cancer, everything. Not being able to have someone to hold you or touch you. I tell you it's going to be all right. Sure, I did some deep breathing, but after a while, that was after that did that nothing was helping. So when we talk about COVID and mental health, everything that goes on in our lives is attached to mental health. My sister does this show. It's called Black Mental Health is Health, and it is. So anything that affects you. So when you talk about mental health, COVID, the impact of COVID on mental health, it's everything. It is everything that we went through, even what we're going through now, and the future, because we still don't know the future of COVID. Think about it. During COVID, what were we not celebrating? What were we looking at? The 100 years of the flu epidemic back in 1918. That was 100 years ago when it wiped out people everywhere. And now, look what's happening. COVID ain't going nowhere. And that's something we have to have grips on. Regardless of what you feel about vaccine or whatever, COVID ain't going nowhere. I think it's going to be so many iterations that it goes through that you notice when I took off my mask. I was teaching some children at a community center, and they were snotting and sneezing, and then I put on a mask because you don't know. And children love to hug. I'm sure a lot of them didn't get hugs during COVID. So when they come up and hug me, I have on my mask. I do. That's to my detriment. It may be to my detriment, but come on. And some of these kids I know. They ain't had nobody to hug them during COVID. They didn't. So when we talk about our mental health, from the elderly to the babies, think about a newborn baby. What did a newborn baby? Oh, except for your mom and daddy, everybody had on the mask. If you were born in 2020, let's say March of 2020, your socialization to just people is somebody with a mask on. So then when you take the mask off and they looking, I'm sure that did something to their mental health. That affected them. Like, who is this? What is this? What does a real face look like? So it encompasses so much that we're going through. What can I say?
Yeah. You've kind of already touched on the third question, but especially just with what you've said about mental health being everything, and physical health as well, but especially with the work that you've been doing with the mind body skills in the community, and with our focus on addressing health disparities. And when you think about health disparities, um, how does stress and trauma, and the disparities in stress and trauma, impact physical health?
Oh my God. Everything. I mean, everything. Let's just take me. And we're being very candid and open. I have diabetes. Uh, I was trying to get a certain medication. I had to jump through hoops because when it went from $30 a month to $178 a month, I had to go through all kind of hoops to fill out papers and all and do that. So just like, and it wasn't even a month, like 178 for like 20 days. So I could probably pay it, but it would have been a strain. So I went through all of the stress of trying to get the medicine, and what happened? Yeah, of course your blood sugar and everything goes up. I'm a fighter. I'm not gonna let anything just stop. But I think of people who can't fight, people who aren't able to fight. What do? A lot of times they just take it and say, "Oh well, there's nothing I can do." And I said, "Yes, it is." My daddy always used to tell me, "Everybody got a boss. There's somebody over everybody, unless you go into the CEO of the company." So one thing I think with stress and trauma on physical health, it's access to proper medical care through your medical professionals, uh, 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 the trauma and stress of not being able to access what you need. Have a friend who needed a gallbladder surgery. She had to go through so many hoops just to get. They wanted to take a stress test, but she needed the nuclear stress test. It took 2 months. I have a friend who just came out of surgery this morning. She's been trying to get so much help because of her arm. It turns out, I forgot what they finally diagnosed. As her children said, "Mama, go to the ER." They had an ambulance to come and get her because the pain was so bad. You know why? Because she was trying to get the test. Once they got to the test, she got to the hospital. They realized they had to transfer from one hospital to the medical center. What do you think that stress did on her physical health? I'm sure it didn't help the condition. Diabetes, high blood pressure, a lot of these chronic diseases. When you're stressed, your level of trauma on your body goes up. Your level of the disease goes up. When you see people who, then you have people. Let's look at Black maternal health. Black women, regardless of their socioeconomic status, are dying in childbirth. The stress and trauma. There was a judge on TV. Her daughter-in-law, who was a doctor, kept telling them, "You got to do this. You got to do this." They didn't listen to her. That baby died. Now her husband doesn't have a wife, and her baby didn't have a child because the stress and trauma. She kept telling them, "What's wrong? What's wrong? What's wrong?" And she ended up dying because she knew. A lot of times, just from day to day, uh, you got a headache, You got a nose ache, you got a foot ache, you got any kind of ache. If I don't have any money in my pocket, let's look at the people who don't qualify for a gold card. Now I could go. I was able to go in because it was an emergency, and then they can't turn you away. What if your salary's right here? You can't afford that. What, $500-600 a month? For insurance for your family, even $200 or $300 for you. All right. This is where you need to be in order to get a gold card. You see how close it is? So what do you have to do? You have to lie. And I'm saying it because I did it to get when I had a gold card, because I couldn't afford the insurance. That was before the Affordable Care Act.
Mhm.
What do you think that stress does to your health when you can't go to the doctor? But I will go. Me and my husband, we're going to go. We're going to find a way to make a way. But can you imagine there's so many people out there who can't go to the doctor? That stress. That stress. I have an undiagnosed pain in my side. They don't know what it is. I've had some of the best doctors. And another thing, doctors tend to ignore black folk, particularly black women. We go in, and I guess black men, they don't even go to the doctor. But when we go in, we can say X, Y, Z. That's what's wrong with me. And they'll write in their notes, oh, it was nothing wrong. She just had ABC. They don't listen to us. So when they don't listen to us, and the more, is it Michael Jackson? So they don't really care about us. We have to fight, claw, do everything in order to get somebody to listen to us. So what do you think that's doing to the disease or the ailment while we're fighting it? What do you think that stress does to the disease? If it doesn't get worse, if you're having pain, I know good and well that pain is still going to be there. And I think I'm getting excellent medical care for my pain. But the stress of not knowing yesterday, I was in so much pain, and like it moved back today. And it's I don't know what to say. I'm pissed off, but I don't know. But I think at least I have access to medical care. I'm gonna try it again. I don't know. There are really no more tests I can take. But when you think of all of that, what does stress have to do on physical health? Everything, because everything starts here. Everything. And if this is messed up, like I do in my group, I tell everybody, touch the top of your head and then touch the bottom of your foot. We do that around third or fourth session. I said, the only thing that you have control over is that. We have no control over. You can't control your children, your nobody, your husband, nothing. That's all you have. And when you can't control it to the point that you still have health issues, you still hurt, you have other outside issues, that's going to affect your physical health.
So that's a good segue to the last question. We have a few more minutes.
I hope I'm not talking too much, but
No, it's great. It's great. But you mentioned the groups, the mind body skills groups, and you mentioned just the higher levels of stress and trauma, especially in communities of color. What are some ways that people can take care of themselves to improve their overall health and well-being?
Well, the first thing is what I said in the last question. From here to the bottom of your feet, you have to acknowledge that is what you have 100% control over. You may not have control over cancer coming in your body. You may not have a control over a lot of stuff. But as far as taking care of it from day to day, that's the one thing that you have control over. So I think one of the first things you have to do is to recognize, admit, and acknowledge what's going on with your body. You have to. Because if you don't acknowledge what's going on, stuff, it's like, what's that game? Everything pops up. You hit the things down before and you'll be putting out fires all day. And being black in America, being a black woman in America, we have traumas every day, just waking up and just taking a deep breath. But if I want to improve my overall health and well-being, again, I have to acknowledge what's going on and then find ways. Number one, um, you know what I think the number one thing we don't do, Cyrus, is have fun. It's like we've taken fun out of the equation. I go to the school board meetings. I think I'll be going tonight. And I go over there and act a fool and protest. I have my signs, I do all of that. But at the same time, like my husband says, you need to stop. Not stop doing it, but just halt it a minute. Let's drive to the beach. We'll drive to the beach on Sunday mornings and watch the sunrise. It's very romantic. And it's just a way to just, find you something that you like and do it.
Mm.
Do not watch the news 24 hours a day. That's enough to make you depressed.
Mm.
That's a whole. During COVID, again, we had to cut off the news because everything was on. This many died today. This many went in the hospital. This many died. Then they're projecting. Oh yeah, we're probably gonna reach 1 million deaths in so and so, and we reached it before. Cut off the news. Now, I'm a news junkie. My daddy always had us watching the news all the time. So I will, news comes on at what, 4 o'clock, 4:30, 5 o'clock, 5:30, 6 o'clock. Come on. And they saying the same thing, and everything is breaking news. Back in the day, breaking news was something. Shh. Now,
So,
the cat
Sister
stubbed
Mona,
its toe. Huh?
since we only have a couple more minutes, I just want
Oh,
to ask if you can, in relation to the same question, just talk about the power of breath and maybe some of the other mind body skills that you're doing in the group.
oh God, it is so awesome. Every day we breathe approximately 22,000 breaths a day, approximately 7,800,000 plus breaths in a whole year. I think the power of these groups is that, and what we're teaching is that we have to be mindful in our breathing. Now, I'm not going to sit and think of the 22,000 breaths that I do every day, but sometimes we just need to stop, look around when things get so chaotic. That I call them praise breaths, because every time we breathe, what are we doing? We're giving praises to God and thanking Him. It's a intentional but an unintentional praise. So I think that's the most important thing. What we do in these groups is get people to breathe. We have all kinds of breathe and meditation. I think it's so important to find ways to make yourself feel, what's the word? To feel good about yourself. That's one thing I think that comes out of the groups. We do drawings. What do you? I love the drawing. What do you want to do now? I mean, what is your life like now? What's a challenge? And what are you going to look like when it comes out? And really, everybody has this big buzz, a face with a big smile. That means they can see it. We do the mindful eating. That's one of my favorite parts. Where we did an adaptation, Cyrus, and instead of eating at the end of the group, I had all the food out, and we just laughing and talking. I had them to stop and reflect on what did it feel like eating that grape, eating that potato chip. I said, see what we do. We're unmindful of what we eat. We just eat, 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 eat. That's another way of taking care of our whole being. The movement. It's so important to move around. What do we do during COVID? What are we doing now? We sat at a computer all day. And when you had to I remember one day I literally sat at the computer. I was just finished my book for 6 hours. When I got up, my knees were cracking and hurting so. It's like, oh Lord. So we need to move. And that's one thing that we do talk about in the group. And I think the most important thing is to acknowledge what's going on in your life. We can hide stuff, try to step over it, forget it, acknowledge what's going on. And the last thing is you got to love up on yourself. Because if nobody else, there's a poem I teach the kids. It's called "I am beautiful, I am magnificent, I'm God's child, and she don't make no junk. I love myself. I will be the best I can be to preserve my own dignity. I will not let alcohol, cigarettes, or drugs touch these lips or enter this body. I will respect myself and demand respect from others. I will achieve because I believe that I can conceive the greatness in me. I am black tabulous. I am magnificent. I am magnificent. And I am, without a shadow of a doubt, absolutely, positively, show enough too tough because I am all that and more. And if you live by that, get you some affirmations and talk to yourself, that goes a whole lot to improving and sustaining once you get a good health and well-being, no matter what comes in your life, because you're going to see some trials. Things are going to happen, but always talk to this. Remember, talk to this thing right here. Whether you look at it, whether you like it or not, you need to learn to like it and keep moving.
Thanks so much, Sister Mama. Um, Appreciate you so much and all the work that you've done.
Thank you.
I know we got to give the time back to Raven now, but um, thank you so much.
Thank you. I enjoyed it.